Hello, and welcome to another edition of the Brain Museum, sponsored by the Mungual Psychology Association. My name is Lobe, and I'll be your host for today. In today's episode, we will be covering a portion of the brain that is imperative in the processing of auditory information and the encoding of memory, the temporal lobe. The temporal lobe is one of the four major lobes of the cortex. It is located in the bottom middle part of the brain, right behind the temples of the skull, which, as you might have guessed, is where it gets its name from. Additionally, the temporal lobe is placed above the brainstem and cerebellum, below the frontal and parietal lobes, and right in front of the occipital lobe. Finally, it is important to note that there is both a left and right hemisphere of the temporal lobe, meaning that there is one temporal lobe on each side of the brain. The temporal lobe is mainly responsible for auditory stimuli, emotion, and memory. As it contains the primary auditory complex, it is in charge of receiving and processing different types of frequencies, sounds, and pitches, and later giving them meaning. As such, the temporal lobe is also widely involved in the concept of selective hearing, actively filtering out unnecessary sounds and frequencies so that we're able to focus only on important sounds from the environment. Additionally, the temporal lobe also plays an important role in the processing and interpretation of visual information, most namely the recognition of objects, faces, and expressions. This particular task is mainly carried out by the ventral part of the temporal lobe, which works to consistently find meaning to objects and surroundings we observe on a daily basis. The dominant temporal lobe, usually located on the left side of a person's brain, plays an important role in the recognition of language, being responsible not only for the understanding and distinguishing of language, but also for giving it meaning. As such, the temporal lobe is often widely involved in the production of speech. It is important to note that the temporal lobe also plays an important role in the formation of visual memory, more specifically, long-term memories. It works in conjunction with the hippocampus and the amygdala in the formation of conscious memories. Lastly, the temporal lobe also plays an important role in controlling automatic and unconscious reactions, such as appetite, hunger, and thirst. The temporal lobe is usually subdivided into three key components: Wernicke's area, Broca's system, and the limbic lobe. Of these three structures, perhaps the most complex one is the limbic lobe, which intersects with several of the other lobes, but directly interacts with the temporal lobe in order to influence the limbic system, particularly through automatic emotional responses, such as the fight or flight response. Due to its considerable size, the limbic lobe is also home to several other structures, most notably the amygdala and the hippocampus. A second important component of the temporal lobe is Wernicke's area, a region in the dominant temporal lobe which is directly involved in the processing and understanding of speech and language. Finally, there is also Broca's area, which, in conjunction with Wernicke's area, also aids in communication, focusing primarily on an individual's ability to speak and utilize language with fluency. Right. Now that we have covered the many different functions of the temporal lobe, you may be asking yourself the question, what are the consequences of temporal lobe damage? Unfortunately, there is no way I can answer this question in a reassuring fashion. The truth is, if you damage your temporal lobe, blue skies and sunshine most certainly won't be a part of your future. There are several consequences that may arise as a result of temporal lobe damage. 1. Disturbance in language comprehension. In the event of right temporal lobe damage, an individual may experience a loss of inhibition of talking. Similarly, in the event of left temporal lobe damage, an individual may experience issues with the recognition and understanding of words, a condition known as receptive aphasia. One specific example of this is Vladimir Ilyich Ulyanov, most commonly known as Lenin, and former leader of the Soviet Union and one of the founders of the Communist Russian Party. At the age of 52, Lenin suffered a series of transient ischemic attacks, that is, strokes that only last for a couple of minutes. As a result, Lenin's brain suffered significant damage to its left hemisphere, temporal lobe, and particularly Wernicke's area. Consequently, Lenin suffered loss of consciousness and developed aphasia, being unable to communicate clearly and coherently with others. In fact, after his second stroke, Lenin would often try to say something, but would only be able to produce incomprehensible sounds, usually along the lines of "vot vot," an expression he would use to voice agreement, objections, complaints, or concerns. Although Lenin was able to produce speech without effort, his sentences did not contain any meaning. Lenin's condition became progressively worse after several episodes of stroke, eventually causing him to suffer from repeated motor seizures, respiratory failure, and death. Lenin's brain damage and the ways in which it influenced his conditions ultimately serve as evidence that the temporal lobe, particularly Wernicke's area, play a major role in language comprehension. A second, yet equally important piece of evidence that also illustrates the role the temporal lobe plays in the understanding of language is the study conducted by researchers Stephanie Nagel, Frank Musiak, and Eric Kozov. In it, researchers investigated whether or not the right temporal lobe was critical for auditory processing by studying a patient who had undergone right temporal lobe resections to treat medically uncontrollable seizures. In order to do so, the researchers utilized a prospective or repeated measures single case study design. As such, they collected data during 4 different occasions during a 2-year period, both before and after the right temporal lobe resection surgeries. In each of these occasions, the patient had to undergo a series of tests of speech recognition under several listening conditions, including silence and background noise. The results ultimately demonstrated that, prior to the surgery, the patient's ability to recognize speech were normal in both quiet and real-world listening conditions. However, after the completion of the procedure, the participant demonstrated a significant decline in speech recognition in adverse listening conditions. This ultimately showcases how the temporal lobe, particularly the right superior temporal gyrus, plays a fundamental role in language comprehension and the processing of speech. 2. Disturbance in visual perception. This applies specifically to the identification and categorization of objects and sights in our surroundings. Additionally, it is also important to note that damage to the temporal lobe may also lead to prosopagnosia, a condition in which the individual is unable to recognize faces. One famous example of a prosopagnosia study was conducted by Jason S. Barton in 2008. In his research, Barton studied the brains of 10 patients who had experienced damage to their temporal lobes and suffered from acquired prosopagnosia in order to gain a better understanding of the ways in which brain damage was associated with this condition. In order to do so, Barton's participants had to undergo a series of face processing tests. Barton ultimately uncovered that the participants who had suffered from bilateral occipitotemporal lesions, that is, damage to the fusiform gyrus, a part of the brain located in both the temporal and parietal lobes in what is known as Brodmann Area 37, had greater difficulties in recognizing faces of famous people. On the other hand, participants who had suffered unilateral lesions to the right temporal lobe appeared to perform better in this test, having less difficulties in the recognition of faces of famous individuals. Additionally, it was also found that participants who had suffered bilateral damage to the right anterior temporal lobe appeared to experience greater difficulties in the recognition of facial imagery and retrieval of facial memories, whereas those who had suffered from unilateral damage did not appear to have as much difficulty. These findings ultimately showcased that damage to the right anterior temporal lobe has a significant impact on the recall of facial memories, thus suggesting that this part of the brain plays an important role in memory formation. Additionally, results also suggest that not only is prosopagnosia more severe in cases of bilateral temporal lobe damage, but also that the left hemisphere of the temporal lobe plays an important role in facial recognition. Other potential consequences that may arise as a result of temporal lobe damage include disturbance in selective attention of auditory and visual input, impaired long-term and factual memory, and emotional disturbance, such as an increase in aggressive behavior, which appears to be particularly true in patients who have suffered from temporal lobe epilepsy. With that, we unfortunately come to an end to this edition of the Brain Museum. Hopefully, you are now familiar with the temporal lobe and its functions. Stay tuned for our upcoming episodes, which will explore other areas of the brain. See you soon.